Greetings viewers. Welcome to the second episode of the health-related lecture video on diabetes. Today we'll be lecturing on the research statistical analysis of diabetes in America, Britain, and Europe, together with the symptoms and some causes of diabetes. Now our next section comes with a question: how common is diabetes in America, Britain, and Europe? Diabetes is common. Statistically, approximately over 38.5 million people in the United States have diabetes, which is about 11.6% of the population. According to the Diabetes 2024 Statistics Infographic by the American Heart Association, for diagnosed and undiagnosed diabetes, over 9.7 million adults have diabetes, while 29.3 million people of all ages, which is roughly 8.9% of the United States of America's population, have been diagnosed with diabetes, with over 352,050 children and adolescents younger than 20 years, and 9.7 million were undiagnosed, while 15.9 million have prediabetes. Research has it that type 1, type 2, and gestational diabetes are the most common diabetes cases in America. It is also said that diabetes cases have bloomed with the increase in the rates of obesity. Obesity is one of the most important factors that increases the risk of diabetes. Ceasing regular physical activities impairs the control of blood sugar levels, glycemic control, in healthy individuals and heightens the risk of diabetes. According to the Centers for Disease Control, CDC, it is reported that diabetes is increasing at an alarming rate in the United States of America. For European regions, according to the International Diabetes Federation data, IDF, in the European region, there are about 60 million people with diabetes, about 10.3% of men and 9.6% of women aged 25 years and over. The prevalence of diabetes is increasing among all ages in European countries, mostly due to increases in overweight and obesity, unhealthy diet, and physical inactivity. In the United Kingdom, UK, it is estimated that more than 5 million people in the UK are living with diabetes, which is an all-time high. The United Kingdom statistical data for diabetes shows that more than 4.3 million people in the UK live with diabetes. Additionally, 850,000 people could be living with diabetes who are yet to be diagnosed. Note that, it was recently announced that the Diabetes UK Professional Conference, DUKPC, will take place from 17th to April 19, 2024, at Excel Centre, London, United Kingdom. This must-attend event is for healthcare professionals, researchers, and scientists, offering a multidisciplinary program that brings together the best and most up-to-date knowledge and insight on diabetes care and research. Generally, the report has it that more than 500 million people are currently living with diabetes worldwide, affecting men, women, and children of all ages in every country, and that number is projected to be more than double to 1.3 billion people in the next 30 years, with every country seeing an increase as published in The Lancet around June 2023. Now, let's go over to the symptoms of diabetes. Symptoms of diabetes. The severity of symptoms can vary based on the type of diabetes one has. These symptoms are usually more intense in type 1 diabetes than type 2 diabetes. Symptoms of diabetes include increased thirst, polydipsia, and dry mouth. Frequent urination. Fatigue, blurred vision. Slow healing sores or cuts. Unexplained weight loss. Numbness or tingling in your feet. Frequent skin infections or vaginal yeast infections, for females. Additional details about symptoms per type of diabetes include: Type 1 diabetes. Symptoms of type 1 diabetes, T1D, can develop quickly over a few weeks or months. Additional symptoms may develop which are signs of a severe complication called diabetes-related ketoacidosis, DKA. Diabetes-related ketoacidosis is life-threatening and requires immediate medical treatment. These symptoms include vomiting, stomach pains, fruity-smelling breath, and labored breathing, that is, breathing at less than 12 or more than 20 breaths per minute with poor or irregular quality, a sign of respiratory distress. Type 2 diabetes and prediabetes. Here the carrier of type 2 diabetes or prediabetes may not notice any symptoms since they develop slowly. Normal procedures of blood work may show a high blood sugar level before you recognize symptoms. Another possible sign of prediabetes is darkened skin on certain parts of your body, which is a skin disorder called acanthosis nigricans. Gestational diabetes. Here the carrier typically won't notice symptoms of gestational diabetes. The health expert is expected to test the patient for gestational diabetes between 24 and 28 weeks of pregnancy. Now let's to the causes of diabetes. Causes of diabetes. Too much glucose or sugar circulating the bloodstream causes diabetes, regardless of the type. However, the reason why blood glucose levels are high differs depending on the type of diabetes. Some of the causes of diabetes include obesity. Excess body fat can cause insulin resistance. Fatty tissue may cause inflammation that can lead to insulin resistance, which could lead to diabetes. Lack of insulin production. This is primarily the cause of type 1 diabetes. It occurs when insulin-producing cells are damaged or destroyed and stop producing insulin. Insulin is needed to move blood sugar into cells throughout the body. The resulting insulin deficiency leaves too much sugar in the blood and not enough in the cells for energy. Insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when cells in the muscles, fat, and liver do not respond as they should to insulin. Several factors and conditions contribute to varying degrees of insulin resistance, including obesity, lack of physical activity, diet, hormonal imbalances, genetics, and certain medications. Gestational diabetes. A small percentage of pregnant women may develop gestational diabetes. It is thought that hormones developed in the placenta interfere with the body's insulin response. This leads to insulin resistance and high levels of glucose in the blood. Women who develop gestational diabetes during pregnancy are at higher risk of developing type 2 diabetes later in life. According to the Centers for Disease Control and Prevention, CDC, women who deliver a baby that weighs more than 9 pounds are also at greater risk. Genes and family history. Genetics plays a role in determining how likely one is to develop some type of genetics in the development of diabetes. According to the American Diabetes Association, statistics show that if one has a parent or sibling with diabetes, the odds of developing it oneself increase. Genetic conditions like cystic fibrosis and hemochromatosis can both damage the pancreas, leading to a higher likelihood of developing diabetes. That's all for now for this second lecture video. In our third video section, we will be completing remaining the causes of diabetes. Please do well to like, subscribe and comment on our YouTube channel, and hit the notification bell to notify you for more important health-related lecture. Gracias.